Understanding Down syndrome, causes, prevention, and treatment. What is Down syndrome? Down syndrome is a genetic disorder caused by the presence of an extra copy of chromosome 21, also known as trisomy 21. This extra genetic material affects the development of the body and brain, leading to a range of physical and cognitive challenges. It is one of the most common chromosomal conditions, occurring in approximately 1 in every 700 live births. Causes of Down syndrome. Down syndrome is caused by an abnormal cell division involving chromosome 21. There are 3 types of Down syndrome, each defined by the way the extra chromosome 21 material manifests. 1. Trisomy 21. Trisomy 21 is the most common form of Down syndrome, accounting for about 95% of all cases. In this type, each cell in the body has 3 copies of chromosome 21 instead of the usual 2. This occurs due to non-disjunction, an error in cell division during the formation of the egg or sperm, which results in an embryo with an extra chromosome. 2. Mosaic Down syndrome. This type accounts for about 2% of cases. In mosaic Down syndrome, some cells have the usual 2 copies of chromosome 21, while others have 3. Mosaicism occurs as a random event during early fetal development when some cells divide normally and others divide abnormally. 3. Translocation Down syndrome. This form accounts for about 3% of cases. In translocation Down syndrome, part of chromosome 21 breaks off during cell division and attaches to another chromosome, usually chromosome 14. Translocation can be inherited from a parent who carries a rearrangement of genetic material but is unaffected by the condition. This can result in a higher risk of Down syndrome in subsequent pregnancies. Risk factors. Maternal age. The likelihood of having a child with Down syndrome increases with the mother's age, particularly after age 35. Genetic factors. Parents who have a child with Down syndrome or carry the genetic translocation may have a higher chance of having another child with the condition. Family history. Although Down syndrome is typically not inherited, the translocation form can be passed from parent to child. Prevention of Down syndrome. Currently, there is no known way to prevent Down syndrome, as it is a genetic condition caused by factors outside of parental control. However, there are ways to assess the risk and prepare for the possibility. Genetic counseling. Couples, especially those with a family history of Down syndrome or those who are older, may benefit from genetic counseling. This helps assess the risk of having a child with Down syndrome and explores available options. Prenatal screening and diagnostic tests. Screening tests. These tests assess the likelihood of Down syndrome in a developing fetus. Common screening tests include the first trimester combined test, which includes a blood test and an ultrasound, and the second trimester quad screen. Diagnostic tests. If a screening test indicates a high risk, diagnostic tests like chorionic villus sampling or CVS or amniocentesis can confirm the diagnosis by analyzing the chromosomes in fetal cells. Pre-implantation genetic diagnosis. In vitro fertilization or IVF. Couples undergoing IVF can opt for PGD, which tests embryos for genetic abnormalities, including Down syndrome, before implantation. This allows for the selection of embryos without chromosomal abnormalities. Treatment and management of Down syndrome. While there is no cure for Down syndrome, early intervention and ongoing support can significantly improve quality of life. Treatment focuses on managing symptoms and helping individuals reach their full potential. Early intervention services. Early intervention programs provide services to infants and toddlers with Down syndrome to enhance development. These may include physical, occupational, and speech therapy. Benefits. Early intervention can help children develop motor skills, communication abilities, and cognitive functions at a more accelerated rate. Educational support. Individualized education programs, or IEPs. In school, children with Down syndrome may benefit from IEPs, which tailor educational strategies to meet their unique needs. This can include specialized teaching methods, classroom accommodations, and additional resources. Inclusive education. Many children with Down syndrome can thrive in inclusive classrooms where they learn alongside their peers with and without disabilities, promoting social skills and academic growth. Medical care and therapies. Regular health screenings. Individuals with Down syndrome are at increased risk for certain health conditions, such as heart defects, hearing loss, and thyroid disorders. Regular medical checkups and screenings are essential. Speech therapy helps improve communication skills, which are often delayed in individuals with Down syndrome. Physical therapy supports motor development and helps address physical challenges such as low muscle tone or hypotonia. Occupational therapy assists with developing daily living skills such as dressing, feeding, and personal care. Social and emotional support, community programs. Many communities offer programs and support groups for individuals with Down syndrome and their families. These can provide emotional support, resources, and opportunities for social interaction. Family support. Families play a crucial role in the development and well-being of individuals with Down syndrome. Educating family members about the condition and providing them with coping strategies is essential for creating a supportive environment. Conclusion. Down syndrome is a complex genetic condition with a wide range of physical and cognitive challenges. While it cannot be prevented, understanding its causes, risk factors, and the importance of early intervention and ongoing support can greatly enhance the quality of life for those affected. Through medical care, educational support, and social inclusion, individuals with Down syndrome can lead fulfilling lives and reach their full potential.